This is Deborah Johnson for Women at Halftime, and I'm passionate about helping women use their untapped skills, resources, and talents to create their ideal work and lifestyle, making a difference in their second half. Well, hello, Deborah Johnson here. I'm really excited to have Marcia Grondahl with me today and a very important topic. Now, Marcia has appeared before on this Women at Halftime podcast because she has quite the background as a neonatal nurse, and we'll get into that. But she's talking about fetal alcohol syndrome and how it's affecting today's kids, a very important subject. So, Marcia, thank you so much for being here today. I'm
excited to be here, Deb. Thank you.
Yeah, it's just really great to have you here. And before we get started, as this airs, I have a new book coming out, The Summit, Journey to Hero Mountain. Make sure you connect with me on social media. I don't have a lot of other promotions going right now, except for this book coming out this fall. So I want to make sure that you get a taste of this. And it's a great one for today, of a real message of hope. It's an allegory, a fun little story, simple, but really fun little story. So, well, let's kind of dive into this subject. And Marcia's wonderful because she has such not only medical experience, but personal experience. So, Marcia, start us out. What is FASD?
FASD is Fetal Alcohol Spectrum Disorder. And it's really a lifelong, permanent brain-based disability. A lot of people will call it an organic brain damage. And it happens when a baby's exposed to alcohol anytime during a pregnancy, from first week to 40 weeks. The brain develops that entire time. And we know that about 50 to 70% of pregnancies are unplanned. So there can be drinking ahead of time during that time of unknown pregnancy. And then also for other reasons, that people drink during pregnancy, but any amount of alcohol will do that. And 90% of those affected with FASD are undiagnosed. It's, again, a spectrum disorder. So it could, affect someone a little bit, or it could affect someone a lot. It really depends on what happened during the pregnancy. It includes physical, mental, behavioral, and learning disabilities. The prevalence in the U.S. is 1 in 20, which is 5% of our population. And it's 2.5 more times more prevalent than autism. But it really doesn't have the face behind it like autism does. And that's something that we're working on.
Wow. Now explain, because when you say it's a spectrum disorder, does that mean you're just meaning that it accompanies all parts of life a little bit there?
It does. Like I said, it could be physical, it could be mental, it can be behavioral, and it can be learning disabilities.
Okay.
So it could be, a few of those, or it could be a lot of it. And as we get through it a little bit, I'll talk about a lot of the characteristics of it. And as I talk about it, you might see maybe one or two, but it could be all of them, or it could be just a little.
Wow. Well, I'd like you to share a little bit of your story. First of all, your background, because you, people that have a passion for this or are involved in this don't need to have your background, but you have quite the medical background as well, but plus an expanded story. So why don't you share some of that, because you are standing on this platform of definite experience.
Well, I actually started out as a pediatric nurse in the pediatric floor in the PEDS ICU. And then I continued on to work in the neonatal ICU. And from there, I became a neonatal nurse practitioner. So I have about 30 years of experience in the hospital with PEDS and neonatal. We saw kids with some of the physical characteristics in the NICU as the babies were born, but we really weren't trained in how that was going to progress once they left the unit. So I did have a basic understanding of it, but not an in-depth understanding. I'm also a wife, a mother of 4, and a grandmother of 10.
Wow. Is it that many?
4 of those are adopted, and 2 of them have fetal alcohol spectrum disorder.
Wow.
As that started happening and we started realizing that there were some behaviors that were not really consistent with, normal behaviors. I started looking into it and started really researching what we used to call it FAS, Fetal Alcohol Syndrome, and they now call it a spectrum disorder. So we've, kind of changed the nomenclature of it as we've gone along. So I started looking into it and started taking classes in it, and got some certificates and things like that. And it really is such an important thing for people to understand, because there's so much hope involved in it, where some of these families feel pretty hopeless.
Yeah. Wow. And with, how did you figure out with your grandkids that you had two, what sort of behavior, and then we'll get into how it's diagnosed, but I want to kind of stay here on your experience a little bit and what you sort of noticed, because I mean, especially babies, but kids. So what did you notice?
Well, what we knew was the mom's history, which is an important piece. We knew on our granddaughters that the mom had drank through the entire pregnancy. Now, my daughter and son-in-law had gone through foster training and had a lot of training, but really none of the training was about fetal alcohol spectrum disorder and what that looks like. Although they had hours and hours of training. So we did know that her mom had drank. And on our grandson, we knew that the mom had done drugs the entire time, and just took him to the ER, and he was put in the NICU to withdraw. And usually alcohol and drugs go along hand in hand. So we knew that was a background thing. And then it was just kind of watching some of the behaviors that started happening, especially with our granddaughter, that were not, it was like a tantrum, but it was more than a tantrum. It was what we call a meltdown. And really, things would happen, and her frustration levels were getting higher and higher that they weren't able to really handle at the time, I would say, or know how to handle it.
Know how to handle it. Okay. And we'll get into, some of the characteristics, but I kind of wanted to know, our audience to know the things that you actually noticed and what was, some of the bells that went off for you. So as we move along here, and we'll come back there a little bit, but how is it diagnosed? You might notice some of these behaviors, but, are they just going to all of a sudden just say, oh, this is what you've got?
Yeah. And that's a really interesting question too, Debbie, because a lot of pediatricians are not really familiar with FASD. They weren't trained with it. They don't really understand the behavioral aspects and the spectrum disorder that it is. So in getting a diagnosis, it really is important to find a pediatrician that is knowledgeable, or a center that's knowledgeable about FASD. The one that we went to is San Diego Children's, and the neonatologist there that does the clinic actually was the one that first diagnosed it in the 70s, and has progressed to a point now where they have a huge clinic that just does FASD diagnosis. There's one at USC and one at UCLA, and there are a few pediatricians around that will also be able to do the diagnosis. And a lot of it is knowing the mom's history, but you can see that a lot of times we don't know the mom's history. The mom may not admit to have consumed alcohol during her pregnancy. So that part is important, but we're not always able to get it.
So it just comes with all of those characteristics, or do they do, when you're talking about behavior, so you're not talking about like blood tests and all of these other things. You're talking behavior, and this is
right.
Okay, so I have an unruly child, or I've got a very active child. So all of a sudden, I'm going to put them in this category. So, so I guess would be my next question: of what are some of those physical characteristics, or how do you distinguish this then? And when you say it's more prevalent than autism, wow. How do you tell all of that apart? And yeah, that's a really,
and because FASD is like an umbrella and diagnosis, and then there are a lot of things underneath it that could stand by themselves and not mean that a kid has fetal alcohol spectrum disorder. So it's important that somebody that actually knows how to do a diagnosis gives that diagnosis. They look at the brain domains, and they do a lot of testing that way. What happens is that FASD, or the alcohol affects the executive functioning part of the brain. And that's the part where you really make decisions. That's where your emotions are. So you can see that a lot of the things that happen with behaviors really will fall under that category. So what they do is they look at IQ, but they also look at executive functioning IQ, because you could have a really high IQ, but if you have a brain disability in the executive functioning area, you don't really know what to do with that IQ. So, a lot of say, but my kid's really smart. I'm sure they are. And a lot of these kids, we call it an invisible disability. I'm going to back up for a minute, because these kids look normal. They talk normal. They, if you see them outside in a setting, most of the time you'll think, well, there's nothing wrong with it. A kid, so it's an invisible disability. A child with paralysis or is blind or deaf, we accommodate them so that we can see, that child does have a disability. But with a brain disability being invisible, it makes it a little more difficult for people to have the compassion, I guess, to know that we're really looking at a brain disability and that we're not looking at a normal brain.
Wow. That's a difficult, yeah.
You think about teachers.
Yes.
You're thinking about 1 in 20 and they've got 35 kids. They probably have 1 or 2 kids in there with FASD, and they're all being treated the same way. And those kids are going to usually have behavior problems.
Yes. And that's with the, as we're talking about the physical characteristics and really the emotional characteristics. So you've talked about it's the invisible disability. So physically, how would that be? How do you distinguish there physically? If it's an invisible, I mean, it would just be basically, emotional around this.
When they first came up with the FAS, and they were calling it the Fetal Alcohol Syndrome, there were some facial characteristics that went along with it. And it was, they looked at the eyes, they looked at the usually thin lips, and then, where you have the little bumps underneath your nose, those are usually flat. But that only happens 2 to 3 days during the entire pregnancy. So most of our kids don't have physical characteristics.
Wow. Okay. So
there are some that they can look at and say, oh yeah, there's physical characteristics, but in reality, most of the kids don't have them.
Okay. That's really, boy, there's so many unknowns then. How do you distinguish this? Even with autism, you can tell because they'll, do a lot of repetitive or not be able to develop and all of that. So this is a really interesting dilemma, I would think. So, well, what do we do then? How do parents first of all, you really have to have some sort of diagnosis, knowing the history, seeing what the behavior is, because it's a real behavior problem.
Let me talk a little bit about what the other characteristics are, because they break the characteristics down to primary, secondary, and tertiary. And then we'll get into what works and what doesn't work with these kids.
That would be great.
So one of them is learning difficulties. And a lot of these kids will end up with an IEP or a 504 at school. Parents, your kids the best, and when they're having difficulty. And this happened with our granddaughter, is that my daughter asked for an IEP and they refused. They said, oh, she's doing well in school, she doesn't need one. In reality, if a parent asks for an IEP, the school has to do one. So she didn't get one until it was much later, until she was in middle school, and really should have had one when she was in elementary school. Now, my grandson had one in first grade and he had a lot of learning disabilities. My granddaughter didn't have as many. And her IQ was probably a little bit higher, quite a bit higher actually than my grandson. The other one is poor short-term memory. So this is like one day they'll know it and the next day they don't. She would know her multiplication tables today and not know them tomorrow. And want to flip around on the floor while she was learning them, which was fine. To sit up in a chair and do all this was too much for the brain. She needed to be moving around when she was learning things. Inferior auditory memory. And this is when you give them a list of things to do and they'll only remember one. And then you as a parent will be frustrated because they only remembered one. So brush your teeth, get your hair brushed, get your shoes on, get your backpack, get ready for school. Well, they might get their teeth brushed. And you're like, I already told you what to do. So it's those kind of things, and sometimes that's just normal kids,
Yes.
but kind of looking at it as being something that happens all the time.
Hmm.
Delayed processing. So this is where if they're being told a story, they may only hear every third or fourth word. Now imagine sitting in school and listening to your teacher and only getting every third and fourth word, and also having a little ADD on top of it.
Hmm.
Paying attention is going to be next to impossible.
Okay. All right.
Impulsivity is also another one.
Mm.
And this is one where, if you're having trouble with being able to know what's right and what's wrong, impulsivity is a hard one on top of that.
Mhm.
And my grandson will just walk by somebody and he'll hit something or do something, and it wasn't that he thought about doing it. It was kind of like it was done, and then he would think about it. So it's a real different one.
Mm.
Abstract concepts. These kids are extremely literal. So you think about things like time flies or fixing dinner, and those kind of things they just don't get. And actually, I've been doing some studying with my granddaughter, and she'll say, well, what does that mean? And it's something that we use all the time in wording, but it's not a literal translation. So it's important that they get the literal translation of what's going on.
Wow.
Now, this is interesting, is dysmaturity. So we hear immaturity all the time. Oh, he's acting immature or whatever. But these kids are dysmature. Now, they may be dysmature in different areas. One may be language, one might be their actions, one might be, something else. But so with Chloe, who is 15, may act like she's 12 in certain areas or this. And so it's their inability to function at the age that they are. So it's a dysmaturity and not necessarily calling them immature. I don't know if you remember the movie Big with Tom Hanks, where he was a young boy and he wanted to be old. And the next day he was a man and he was still acting like he was 10 or 12 or whatever. That's kind of thinking like along those lines.
Ah, okay. Good.
Sensory is a big deal with them, and it could be hearing, it could be visual. If they're sitting in a room, they might hear somebody tapping their foot, they might hear somebody tapping a pencil, pages being moved, where we can filter those sounds out and focus on a teacher talking or something like that. They hear all of that going on at the same time. And so to them, it's really frustrating and distracting for them to be able to focus on what they need to.
Right.
Then, of course, problems with attention. A lot of these kids will have ADD or ADHD. Mm-hmm. And then judgment and consequences. They do not get consequences. And it's extremely hard for them then to make good judgment calls. So if they say they're going out to a movie with their friend and somebody comes along and says, oh, there's a party going on, they're going to say, well, that's fine. I'll just go to the party. I don't have to call my mom. I don't have to think about any of that kind of stuff. So it's impulsivity, not understanding consequences. What's going to happen? What's going to happen if my parents find out? So those kind of things are really hard. And when they're given consequences, they don't get what that consequence is for that behavior.
Or they don't remember, maybe, because you said they have the, one track. Yeah. Interesting.
Yeah. So, excuse me, I'm morning coffee this morning. So those are primary characteristics. And you can see that somebody might have just a couple of those, or somebody could have most of them. Right. And my granddaughter has most of those.
Wow.
Although she is quite smart and is a beautiful young lady. Mm-hmm. So you would never know it, and speaks well.
Uh-huh.
So do you want to go on to secondary?
Yeah, let's go, because I'm going to, I'll remind our audience that I always put out an article with every single podcast. And so I will list, some of these characteristics and also some references for our audience to click in and even know more, because you can only cover so much in this short time. So yes, let's cover some of the secondary, definitely.
All right. So when these kids are continually frustrated and not really accommodated to be able to fix some of those things that are going on, some of the things that happens are mental health diagnosis. A lot of these kids end up with anxiety and depression. They're easily frustrated. They're quick to fatigue. Mm-hmm. School performance starts to go down. And that's what happened about 8th grade with Chloe. She started skipping school, not going to school, getting in with the wrong group. And they have a very short fuse. And this is what I was talking about, the meltdowns. So what'll happen is the difference between a tantrum and a meltdown is a tantrum, once they get what they want, they stop. With a meltdown, it just continues. And it can be name calling, it can be holes in the wall, it can be cutting, it can be a lot of different kind of things. So it's that frustration, where we have the ability to kind of, as we get frustrated, be able to smooth our brain out a little bit, they can't. And so they go from this, to like flipping their lid, completely out of control, and they go into the fight and flight mode. So, and a lot of them don't even remember what they've said afterwards.
Right. And just to, I'm not putting the video out for this, but just your little illustration of this was like just a fist. And to this was like both of your hands out big. So just that, extremist, different. Yeah, difference there.
And again, if these aren't caught, then they go into the tertiary characteristics. And this is where a lot of kids end up. So they're constantly in trouble at school, running away from home. They have, a lot of these kids are hypersexual. The girls end up pregnant. They're in and out of custody. And of course, our judicial system does not understand a kid with FASD with a brain disability. And so a lot of times the punishment is much worse than it needs to be for these kids. Addiction, mental health issues, suicide, and of course, gangs. And a lot of this comes from FACETS, FAS, CETS, and Jeff Noble, where a lot of the training I did was under them. And my granddaughter did hit a lot of those characteristics when she was in the 8th grade. Wow. And was doing drugs, running away, and ended up in rehab for a few months and is back home, but we're still having a lot of difficulty with some of those. And now she's going into 10th grade.
Wow. I mean, you come from such experience on this and passion on it and how important it is with education, people understanding what this is. And also listening to this are grandmothers and, not only, or parents who have, their kids are starting to get a little older, to educate those kids. Okay, so watch, you guys, this is something that could be a problem if you ever find yourself pregnant or whatever, or for grandkids, especially with the foster kids, there's so many too that are, coming into homes and people are caring for, and they don't understand some of this. So.
One of the other things that I just want to say too is that kids can have executive functioning disability without it having been caused by alcohol. So somebody will say, well, my kid has a lot of those things, but I absolutely did not drink alcohol during my pregnancy.
Right.
There's still can be traumas and things that happen that make this. And so when I talk about what works with it, it works with executive functioning disability. So think about it that way, as opposed to just being fetal alcohol spectrum disorder.
Okay, that's good to know. So, because you're thinking, oh, this can't be my child, or can't be, just can't be. So, but autism, that's kind of the same. Okay, that's not gone to your family. And I mean, it might be just out of the blue somewhere too. So, just kind of interesting.
So let me tell you about what works and what doesn't work. Is that a good way to go?
Mm-hmm. Yes,
so one of the things most of us were grown up with was, when we were in trouble, was lecturing, grounding, timeout, sitting in a chair. Some got spankings, lots of privileges. And that was how we learned to become better at our behaviors or making better decisions.
Right.
None of those work with these kids.
Wow.
So what happens is parents are using these because that's what they've been trained to do. And that's the way that they were raised. Mm-hmm. And what's happening is that this sets off a meltdown, or it makes the meltdowns worse, or the kids get totally frustrated because people aren't understanding, where they are, that it gets frustrating for the parents and frustrating for the child. Mm-hmm. So it really affects both people. So the thing that you need to remember is that it's an organic brain disease and it's a disability. In Jeff Noble's book, I just want to read this. He goes, let's imagine how it feels to be in trouble every day for things that you cannot control, but everyone thinks you can, and you're just choosing not to. And the worst, you are not able to defend yourself because you don't have the skills to do so. So you think about that as, the inside, and it just sort of breaks your heart a little bit.
Right. I'll put that resource too, that book resource. That's a great one too.
It is a good one. And it's an easy read too. So it's quick to go through. And he also has an incredible training program that people can go through. So what we need to be thinking about, number one, are what their strengths are. These kids have a lot of wonderful, beautiful strengths about them. And that's what we have to capitalize on. Mm-hmm. And it's not them getting their degree and going to college and doing all those kind of things. Now, some of them may do that, but some of them may need to excel in something different. Mm-hmm. So a lot of the things that common strengths are music, athletics, good with pets. They're creative. They like to help. Determined and willing. And I would say that Andrew and Chloe fall into a lot of those places right there. So it's really important as a parent to do things that they can succeed at, so that they're not always feeling like they can't do something, or I don't do this well and I don't do that well and I'm always in trouble, but things that they can really excel in makes life a lot easier for them. And then the other part is accommodations. Now, when I say accommodations, some people and parents that are accommodating their kids, people will say to them, well, you just give in to your kid all the time, or you just do this, or you just do that. And you just have to not listen to other people because they don't understand where you are and what's going on. But for people that are blind, they get leader dogs, walk signals that talk to them. Deaf people have new phones, sign language, doorbells that, flash. And then you've got your people that are paralyzed or in a wheelchair. They've got curb cuts, they've got lower telephones, all those kind of things. But how do we accommodate these kids? These kids have a disability. How do we accommodate them? So a lot of them, what we need to think about, number one, is environment. Needs to be less busy. Now, I love teachers, and I think teachers do a great job setting up their classrooms every year. But you think about when you walk into that classroom, there is not 1 inch of wall that doesn't have something on it.
Yes.
Right? They're beautiful. Well done. But can you imagine a kid that has sensory overload? They walk into that room and all of a sudden they're like, whoa, what? Or you've taken them to an amusement park and now all of a sudden they've got sounds, they've got smells, they've got sight, they've got this, and all of a sudden they're on the ground having a meltdown. Wow. So, it's thinking about the environment that we're taking them to. Do we need to take them to something that's, just kind of a little bit not quite so abusing.
I can imagine some homes that are full and that are, you have something everywhere and pictures and books and all of those people. Yes. Right.
So being less busy, we need to think about how we respond to them. And what's our facial expression? What's our body language? I mean, our voice could be calm, but we may be rolling our eyes or doing something else. So we need to think about how we're responding to the action that's going on. And I know that sometimes I've responded when Andrew's done something impulsive, I've responded inappropriately.
Right.
So it really is taking a step back and thinking about it before something comes out of our mouth.
Right.
Pick your battles. Is it important or isn't? And you know what? This is important with every kid, no matter if they have that.
I always say major on the majors. This is good. Pick your battles. Okay.
And they may not need to battle. They may need just support right now. They may be empty and they're acting out, and they may need just somebody to sit with them and hold them and love them. So we kind of have to look at it a little bit different, where somebody else on the outside might be saying, oh, you're just giving into them. Oh, you're just, no. I have a kid with a disability and this is what I need to do for them right now, because that's where their brain is. A lot of them, we used to call this an external brain. So it's like somebody that can help them make the right decisions and that kind of stuff. They don't really like that terminology anymore. So it's kind of like a support person or a mentor. And the example I gave before of a kid being out and going to a movie and then somebody coming along and saying, oh, let's go to, it would be like having a really good friend that understood your disability and would say, no. We told our parents that we were going to the show. So that's what we're going to do.
Yes.
So come on, we're not going to the party. We're going to do this. So their friends are really, really important.
Oh my gosh. Yeah. Their friends are important anyway. And I can't imagine the magnification on someone with FASD. Wow.
So supervision on these kids. And remember, again, we talked about dysmaturity. And so although all of their kids that are in the 8th grade are going out to the mall together, well, they may not be 8th grade level. They may be 6th grade, and they may not actually be able to go out to the mall at that time. So really, again, judge your kid not on what their age is, but what their dysmaturity level is and whether they can make the right decisions when they go out and who they're going with. But supervision, supervision, supervision.
Right. Right.
Structure, schedules, those are great for them because they know what to expect. When they don't know what to expect is when it's really difficult. Summertime, when you don't know what's going on, can be a really, you think, oh, we're out of school, but school's a structure, a daytime, this day, and weekends sometimes are the hard time. So think about that structure. And a lot of parents will put up lists of things, so there'll be a list in the bathroom. This is what's going on, or they'll have a daily chart of the things that are going to happen in kind of times so that kids know ahead of time of what's going on. I know Chloe always wants to know exactly what are we going to do today then? And what's, that kind of thing. So habits and a lot of the impulsivity, by reinforcing and re-talking about it every time you may think, I have told them that 1,001 times. That's okay. 1,002 times.
1,002.
So it'll actually happen, and they will start getting that habit of not having whatever's going on at that time.
Right. Right.
They mostly need a safe place to be. They need to know that they're safe at home, and they need connection and relationship with the people that are there. So spending time talking to them about things. And this is the thing with Chloe that we found is that Nikki will go through, my daughter will go through a scenario, and they'll talk about it and they'll have a really good discussion. Now it may happen again, but maybe the 3rd or 4th time it won't, because they will have talked about it again and again and again. And so don't get tired of talking, because it really may make a difference in later. But the connection, relationship, and safety are really your top priorities.
Right.
And then learn some calming techniques.
Oh, okay. Now you also do, because Marcia also does oils, and you've done those for you combine the naturopathic with the medical.
Right.
So so calming techniques, talk about that.
Well, one of the things, and I'll tell you with Andrew that really worked, a lot of these kids will hold it together, like all through school, and hold it together, and then get home and just be a monster.
Wow.
Not the right thing to will just be coming unglued. I should say that way. Their brain has had it. And so they're going to be impulsive. They're not going to be nice. They could be in a meltdown. So the thing that my daughter started doing is make sure that when he got home that he had something to eat. And that she put some really grounding blends on his back, down his spine. She used a couple of doTERRA ones, and they both had oils in them that were grounding and calming. And she would put those on his back. He would have something to eat, and he could go until bedtime.
Wow.
So it made it a huge difference. And again, every kid is different. I mean, what works with one may not work with another, but it's nice to be able to try some different things that work well. Find things that they like to do. Do they like music on? Do they like to paint or color or do crafts, that kind of thing?
Right.
A quiet room is always nice. Step away and breathe. And this is for the parent.
Yes.
And
of all these things, you're stressed as a parent anyway. Wow.
They talk about counting to 10 and that kind of thing, but take 10 really deep breaths.
Yes.
And that actually will calm your brain down, because, as they get melting down and they get more and more escalated, it escalates us too. So it's important for us to be able to calm ourselves, because the more we get escalated, it's going to escalate them.
Right.
Learn your kid. So learn what things are going to melt them down and be able to sidestep those so that it doesn't happen. You're not always going to catch it, but a lot of times you can start saying, oh, I know that's going to create a meltdown. We're going to do something a little bit differently this time. Swings are nice. They have a lot of those swings that you can put in your home. And some of that motion back and forth will help. A lot of times we'll tell Andrew it's time for a brain break.
Okay.
Go sit on your bed for a while and, look at a book or do something or just take a break.
Okay.
Trampoline.
Ooh.
Now,
Yeah.
actually helps the brain focus by
Oh,
the
interesting.
which is really interesting. Teachers are telling kids to take it out of their mouth all the time, and they should be handing out pieces of gum.
Isn't that funny? I chew gum because it moistens my throat. And so I'm thinking, oh, do I have a diagnosis here? So I know I'm laughing about it. It's not that funny, but it's
Right. A
yeah.
bouncy chair will help.
Okay.
And I know that when I was helping Andrew with math sometimes, as he would count, he would bounce in his chair with each number that he would count back on.
Oh, neat.
You can put elastic bands on the bottom of chairs so that they can put their feet on them and then bounce their legs.
Oh.
That's kind of a nice one.
Mhm.
And it was interesting. Andrew did start to go to school this year that was for kids that learn differently.
Mhm.
He came home the first day and said, I got to chew gum and sit in a bouncy chair.
That's the main thing he remembered.
And then after that, in days, he'd say, Mom, I can do so good in school. And he was in fourth grade. So that means that he was not feeling good about school up,
Yes.
till this point.
Mm.
Most important for these kids is that they know they have a safe place and a safe relationship, one that's not counterintuitive to what they're going on all the time.
Boy, that's a lot. A lot of information. A safe place, a safe relationship. The the parents, I mean, it's just you've got to have a bucket load and more of patience. But sometimes when you understand, it helps the patients on it. When you understand the learning. And Greg and I have not had kids that have disabilities, but the temperaments and so different. When I started understanding the difference, it helped me to accept them and accept their learning style a lot more.
Right.
So,
and that's a good thing to remember too, is that each of our kids have a different learning style. So, again, it's important for us to figure out our kids ahead of time. Teachers don't have that time to do that flexibility. So number one, you need to be an advocate for your kid in school. Over and over and over again. They're going to say, oh dear, here she comes again. But
right.
That's okay, because that's what your kid needs.
Right. Well, this has been a lot of information, a whole lot. But again, I will urge everyone to really go through the article. There will be extra resources. I usually give extra sources. Part of my mission to those at halftime, which is officially over the age of 40. It comes very fast, very, very fast. But is to help educate in some different areas and, really make our world a better place and your second half better than your first. And understanding some of these things will help you with your kids and your grandkids and those around you. We have a neighbor that has a little autistic boy, and understanding his way of communicating, he communicates different. I can't just tell him something. I have to almost show it. So that's really important. Well, what one or two things do you want people to really walk away with this? And then I want to give them some contact information and how they contact you.
I think it's really two pieces. One is pre-pregnancy and one is after pregnancy. So I want people to understand that any amount of alcohol can create FASD in a child anytime during pregnancy. And we still have OB doctors out there that are telling women that it's okay to have a glass of wine once in a while. It's okay to have a beer. And it's not. So it may cause FASD. And I'm saying may because it might not every single time. But if it has a possibility, who wants that possibility?
Exactly.
And no mother wants to harm their child. I don't care.
Of course. No.
The other one is that although it may feel hopeless, it's not. There is hope. And with changing your thinking, remember it's brain, it's not behavior. It's a symptom of a brain disability. And that with safety and relationship and really rethinking your approach to things really can make a huge difference. Right.
I love that with the safety and the relationship and how they need that connection and all of that. So important. And I've seen, because, I've, for our listeners, I've known Marcia for a very long time. I have no idea how long now, but through a lot of different stages of your life, and delightful person. And but, with being hit with all of this, how you have really stepped up to be able to help educate others. So how can people contact you? Because you do speaking, not only with people, you love with people, of course, if it's local enough. You're very busy. 10 grandkids. Is that how many you've got now? Yes. Okay. But you do a lot of virtual training as well. And that's as easy. We've come through a really period of time where people are very used to this. And so to be able to educate, and you've done different groups before, the unwed mothers, you've done with foster care, you're doing a lot of that now, and just being able to share some slides and personal experiences and how that has helped people. So how do people contact you and get any more information from you?
Well, they can go to the website. It's www.fasdkidsspeak.com. And I think Deb will put that in the bottom.
Yes, I will.
And I have an email is marcia@fasdkidsspeak.com.
Good. Yes. And FASD kids, plural, kidsspeak.com. Yeah. And I will put the link in there to make sure all of that. And you'd probably be available just for a short talk or a short, even a conversation if someone has a question. And so you can give them, but I am so happy that we got to do today, because I really wanted to enlighten people with, this was a lot of information today. It was kind of a big mouthful. Yes, a big mouthful. Sometimes you would wonder, okay, should I spend 2 weeks? But really, once you get into this, you want to be able to get the big picture. And I think that's what people we be able to paint that big picture today of what FASD is all about and what it is. Mm-hmm. What it is and how to prevent it. Yes. And so be obnoxious and tell people, it's not okay to drink alcohol while you're pregnant. And even if your doctor said that, it's really not. And on my website, I have a letter that my granddaughter wrote to me about what it's like having FASD. So that's an interesting piece to read too. Oh, that'll whet people's, if they've stayed all the way through this, I hope so, but just, you've got to go to the website now. That's from Chloe, I'm sure. So yes. Well, thank you so much for being here today. And it's been an absolute pleasure to be able to present this very important subject. For our listeners, next week is a subject I'll be talking on what it takes to develop an abundant mentality. That word is kind of thrown around, abundant mentality. And we're not just talking about finances, we're talking about a lifestyle. So it's a really great, a lot of talk about mindset these days. And so what is that abundant mentality? I have some very, very basic good tips for you in that session. You can always contact me through womenathalftime.com and through any of my websites, goalsforyourlife.com, DJ Works Music. I have plenty of websites, so you can get a hold of me anywhere. Follow me on any of the social media as well, because I'm always doing something, having some sort of Facebook Live or something else. Deborah.Johnson, that's on my Facebook, and I have Instagram, Deb Johnson Works. So thank you so much for being with me, all of you today, and I will look forward to being with you next time. And bye for now. Thank you for joining us on Women at Halftime. Visit goalsforyourlife.com or womenathalftime.com for many more resources, downloads, and programs, or to get in touch with me. I'd love it if you leave me a review and tell your friends. So until next time, this is Deborah Johnson signing off.